The things that matters most to patients is their outcomes and their happiness. How do they feel when they went through the process? Do they feel like people cared, and do they feel like people did a good job at that? They can expect me to be focused on what they want to get out of the visit, what they want to get out of their experience. Oftentimes patients come to me because of something that another physician asks them to be evaluated for, but the first thing I ask them is, what brings you personally in today? Because what they have in their minds might be different than what their physician has, maybe different than what their spouse who's sitting next to them has, and everyone has a different staked interest in it. Finding out what the patient is looking for in the visit, I think, is the most important thing at figuring out sort of how to get them to their goal. You don't know how to get them to their goals unless you know exactly what their goals are. There's a lot of things to love about being a cardiologist. Feel like I get to do a little bit of everything. I get to spend some time in the ICU. I get to spend time in the hospital doing procedures, taking care of patients for many years. I feel like I have a longitudinal kind of care approach where I could take care of patients for many years and sort of help their disease process improve and hopefully recover and resolve. One of the things I really love about working here is that I get to be part of the Cardiology Fellowship Training Program. So I find that it's not just that the way I do a procedure today is different than the way I did it 10 years ago. It's different than the way I may have done it 2 to 3 years ago. You have to stay on top of the latest technology, the latest advancements, the latest adjustments you can make to reduce complications and improvements. And so that's part of the fun of doing cardiology here, at least, especially with the training program, is because it's this constant effort of improvement and growth that you get to do throughout your career, basically. I think that the trust between doctors and patients is incredibly important, not just that the patient trusts the physician, but vice versa. I think that when you have, and that's not something that's given, I think it's something that is earned. I think you earn it by being diligent. I think you earn it by being honest. I think you earn it by working hard at every step of the way. And I think that's something that I think I need to strive hard to earn that trust and to keep that trust. For me, it's everything. I love getting to know people. I love helping them. I love the fact that when they walk out of my office, they either are going to be better for that experience or they're enlightened about their medical issues so they can better help tackle the lifestyle modifications they could do for it. I think it's just incredibly enjoyable. I feel like I've really made a difference in people's lives at the end of every day.